All right, this week we'll be looking at UN Sustainable Development Goals 1 through 3, no poverty, zero hunger, and good health and well-being. Again, the Sustainable Development Goals are making the world a better planet, making the world a better place to live. And this focuses on the 5 Ps, which are people, prosperity, the planet, partnership, and peace. And this time we're going to focus on people first, ending poverty, ending hunger, providing good health and well-being for people. A couple of weeks ago, I was leading a class on sustainability for a local company, and I asked the groups, what's the most important environmental issue that we face? Without hesitation, one of the groups said, poverty is the biggest, because poverty affects everything else. Our ability to pay for clean energy, our ability to have sustainable cities is tied to the economy. All of these things in some way, shape, or form are tied into that. The assignments that I've given for this week, the readings and the videos, really kind of focus in on 3. They focus on quality education, gender equality, and reduced inequalities. Poverty really affects inequality. Those without funds can't afford to have a secure source of food. They can't afford to get good health care. And so this inequality kind of ties 1, 2, and 3 together. Gender equality also can impact the way that women versus men or others can access food, healthcare, etc. And this can then impact their ability to seek an education. So we're going to look at all of these things together, but kind of especially these ones. And for this PowerPoint, I'm going to focus on the linkages between 1, 2, and 3. One way this has been described is called the poverty cycle. So it's a cycle that depressed economic conditions can lead to inability to access good food, safe water. That can lead to disease, that can lead to further economic decline, etc. So if we start with low personal income, then a person would have less access to food or safe water. They could have hunger, poor sanitation. They might have increased disease, malnutrition, increased likelihood of death, less access to health care. This can then deplete the workforce. It can cause people to have more sick days, which can then cause them to earn less money, leading to economic decline, which then again lowers the personal income. So it's kind of a vicious cycle, and it impacts all of these other things. Now, one of the links that I've given you in your readings, and I don't want you to read all the details of this website, but what I want you to do is some of the maps on this page right here are interactive. So you can access this from the Blackboard learning module, and it will let you adjust a slider bar at the bottom to look at things over time, how things have changed worldwide over time, such as the share of the population living in extreme poverty. These are data from 2015, the last year where we had good data for nearly every country in the world. And so I think it shows the amount of poverty in the places where poverty is the highest. Even in the United States, this is between 1 and 2% live in extreme poverty, and this is $1.90 US per day. And this is always adjusted for inflation and the differences in the cost of living between different countries. So some countries are doing very well. Overall, extreme poverty is actually getting slightly better over time. If we look at the world's population since 1950, the population has grown from 2.5 billion people up to 7 billion people. The number living in extreme poverty increased with the population, but since about the year 2000, that number has pretty much declined. But again, this is extreme poverty. We're talking $1.90 US dollars per day. So that's pretty tough to live on that. I think this is maybe a better description of the amount of poverty, different poverty thresholds over time. And let's just look at the 2018 data because I think this provides kind of a snapshot of where we are right now. The US and Japan are in the wealthy nation category, above $10 US per person per day. Other nations are kind of in this middle category, $3.20 to $10 a day. And extreme poverty or marginally extreme poverty, almost on that border, would be less than $3.20 a day. So looking at this in terms of the percent of the world, 38% of the world's population have fairly abundant resources, over $10 US per day. About 39% live in this middle category, and about 23% of the world's population live in poverty. This can lead to then having food insecurity, and this is even within a wealthy country. This is within the United States, a nation that we just said is fairly well off. Still, 10.5% of U.S. households live in what we call food insecure household. They're at risk of not knowing where their next meal is, or very high risk would be 3.9%. This has changed over time. It's the yellow line on the graph to the right. Got as high as about 15%, and it has declined in the last few years, but experienced an uptick with the pandemic, especially for households with children, where more of them were there was an increased rate of households with children that experienced food insecurity during the pandemic. In the city that I live in is Norfolk, Virginia, and one way that people in our community have worked to fight food insecurity is to provide it, especially in communities where there's a higher proportion of the population that's living in poverty. This is a local community garden about 8 minutes drive from my house. And local residents have planted a garden to share with the community. They planted all sorts of vegetables. You can see sunflowers here. They've had a variety of things, tomatoes and peppers and collard greens and things like that. And when they harvest them, they place them in the little bucket on the rocking chair, and it says free. It's for people to take as they want. This is also a local gathering place for the community to come together for local picnics and share food. And sometimes the kids will come to this garden after school so that they can get a snack. They also have chickens within this area that they keep, and this can provide a free source of eggs for local residents that otherwise might not be able to get that. Another way that local communities are providing for those in need is something that's called a little food pantry. They build these little shelters, and it usually has the phrase something like, take what you need, give what you can. People will come and put canned foods or boxes of cereal or spaghetti in there, and when people need it, they can take what they need. It's provided to anyone who needs it, and those that can provide will help to restock this in their area. So this is, again, it's not good to have food insecurity, but this is one way that local communities are coming together to fight the food insecurity that exists in our communities in the U.S. One place where Japan ranks really well is in terms of universal health coverage. There's required health insurance. The statutory health insurance system covers 98.3% of the population, and the public social assistance program covers the remaining 1.7%. So health coverage is available for all citizens, and resident non-citizens are required to enroll. This includes two types of mandatory insurance: employment-based plans through your employer, Or for people that either are not employed or are retired, there are residence-based insurance plans based on each prefecture. And overall, Japan is in among many countries of the world that provide universal health coverage for their citizens. The nations in red do not, and I believe the blue or light green, there's some sort of in between where some level of protection is provided for everyone. In the US, most people do have health insurance. 91.4% are covered by some form of health insurance, and this includes um, employment based plans and government based plans. This varies from state to state, and I hate to say that it's kind of a political issue in the United States, which is why we have not been able to enact universal health coverage. And certain regions have higher rates of people without insurance coverage, the dark blue in the map shown here. So it ranges between about 5 and over 12%, depending on the state. Likewise, even if you have health insurance, even if you are using government sponsored health insurance, that doesn't mean that everybody can afford to see a doctor and pay the copay. So this is going to vary by state. It varies between 6.2% and 14.6%, basically looking at people's economic status and whether they could afford to pay a doctor's bill after insurance. So this is not good, but it's kind of the situation that we're in, and it points to the importance of looking at these three things together: poverty, hunger, and access to good health coverage and health care systems.